Hi everyone, welcome back, and we'll be continuing on with our session on bridging the gap in behavioral health services. So as this is the first session, I think it's important for us to just recap the couple of topics we've already been able to cover: the importance of behavioral health, the signs and symptoms of behavioral and mental illness, and behavioral health services. So now we are moving on to the final portion of this session. Yes, everyone can be very excited about that. It is the role you can all play in behavioral health. So this session we're going to talk about how can you play a role in behavioral health. You as all primary care providers, whether you are a physician assistant, nurses, dentists, dental hygienists, EMTs, so forth, how you all can help the community when it comes to behavioral health. So I think we should all just circle back to the importance of behavioral health. I'm going to let you guys take a couple of moments just to think back on what we've discussed so far in behavioral health and how it would actually help you all better play a role in the community. Okay, so based off of some group discussion, it seems like we were all able to come to the conclusion that yes, more people are exhibiting signs and symptoms of anxiety and depression, which has been pretty prominent over the years. As we all know, mental illness has become an increasing concern throughout society within the US and internationally, and unfortunately the pandemic of COVID-19 has really exacerbated these specific mental health illnesses. So we are seeing an increase in more people exhibiting specifically anxiety and depression, and also within our community specifically, that is also being seen along with some substance abuse disorder. So that was why those three specific behavioral health illnesses were heavily discussed earlier on in the session. So because this is increasing so much, we really need to better advocate for behavioral mental health. It's crucial, it's absolutely imperative. It's really important for all of us to have happy, healthy lives. And in order to do that, we need to have really good headspace. So I thought this was an interesting graphic to share with you all. And maybe you could put it within your offices or find a way to spread it within the community, the importance of mental health. So it is important, something everyone has. It's intrinsically linked and probably inseparable from physical health. So for example, some people who exhibit anxiety sometimes have gastrointestinal problems and so forth. It's also on a continuum, so no person can have the same level or degree of a mental illness in another person. It's worth making time for. Part of being human, something we all need to look after. It can be positive and negative, changeable, complex, and real. And the other side of this graphic is what mental health isn't. It isn't a sign of weakness. It isn't shameful. It isn't all in your mind. It isn't something negative. It isn't something to think about only when it feels broken. It isn't an interchangeable term with mental illness. It isn't feeling good all the time. It isn't something you can snap out of. It isn't something that can be fixed, and it isn't fake news. And I think this is a really important graphic as we are all trying to help combat the stigma behind mental illness. And within the community, a lot of people sometimes struggle to come forward when they feel like they are struggling with mental health and understanding maybe the importance of it. So as providers, you all can bridge the gap in providing this information with the community, sharing with them what mental health is and what it isn't, because sadly some people may be nervous to come forward, which is quite common in all communities, but especially in rural communities. Maybe they don't have the same education you all have here, where you're aware of what mental health and what mental health illness is. So keeping that in mind, how is this impacting our community? As we've already discussed, it is very prominent anxiety and depression throughout the world, as 1 in 5 adolescents worldwide are already struggling to cope with mental health challenges. So this was all prior to the pandemic. The pandemic has prolonged and compounded these issues, and it's doing so by impacting our youth. I'm sure you guys are all very well aware of this. With social distancing and also keeping others from their loved ones, it's impacting mental health. It's impacting it in our youth, so kids that are trying to go to school. It's happening in teens, adolescents, even full adults like you all. It's really impacting all of us, and it's exacerbating mental health illness, which is really hard for all of us to deal with. And it's important as primary care providers that you guys could potentially step in and help with this piece. And another piece to also share here is that the suicidal thoughts have doubled among Maine's youth adults since the pandemic began. So that piece is really important to mention because one of the main goals of this program is to decrease suicide. It's part of its for suicidal prevention. Sorry for the stutter there. But the main goal is to help try to decrease the number of people that are completing suicide, essentially. And it's really important in our young adults, such as those in their early 20s. It's often found that anxiety and depression are comorbid, so they can both happen together in an individual, and it's quite common in young adults. So if you're able to step in and possibly prevent that and decrease the number of patients that are having suicidal thoughts, you're helping the community. You're able to create that impact in them. And just to circle back, I think it's really important to show this graphic to you all here. If you have the site access, you're able to hover over each state individually to see the total number of suicides for the range of 2012 to 2016. And I think the wording of this should be really changed to total number of suicide completions, just to make sure that we are cognizant of the proper terminology and to just be more aware of the mental health crisis. But anyways, in Maine, the rate per 100,000 residents in the year 2016 was 17.07. So that means 17 people per 100,000 residents completed suicide. I'm not sure to others if that seems like a lot or little, but this article specifically had reported the rate back in 2016. Like I said, it's about 17 suicides per 100,000 people. The national rate was less than that. This is so important for us to help play a role in suicide prevention here in Maine, but especially in rural counties. Rural states like Maine tend to have higher rates of suicide, while more urban states suffer fewer suicides per capita basis. So as you can see, just the fact that Maine is rural, and we are specifically talking about a rural community here, we really need to play a role, and rural counties really need some help. And due to the lack of behavioral services, it's important for you guys to bridge that gap. So we've already really gone over signs and symptoms. So how does that play a role for you all? Because you may not be a clinical psychologist or a psychiatrist, so forth, but you could integrate this new knowledge of mental illness into your practice. So there are some graphics on the right-hand side for you all, the common symptoms of depression, anxiety, and substance abuse disorders. Again, these three were specifically highlighted solely because they are more prominent within the community. So taking these graphics, you could use them for future reference, for you to reflect back on, but you could even use them to help educate your staff and other connections and other friends within the field you have. So knowing these signs and symptoms and integrating them into your practice, you'd be able to observe or pay closer attention to your patients, because maybe someone is exhibiting one of these signs or symptoms and you weren't sure beforehand, but now you have this new knowledge. And this is going to allow you to speak open and honestly with your patients. So you could have an open communication and ask them how they are doing. And maybe just that conversation makes them feel more comfortable to share with you how they are truly feeling, where their quote-unquote headspace is, and so forth. It's really important. So as a provider here, your role could be just taking this new knowledge of signs and symptoms and sharing it with the public, sharing it within your practice as well. And the last portion that you're able to play a role in is behavioral services. So there was a whole different section of this session specifically dedicated to it, but we have been able to provide a list of available services to you all. This list is over here on the left-hand side. Now it's important to note that this is for both Kennebec and Somerset County. So that means 2 counties are sharing these resources. So in general, it's probably difficult for these patients to receive care because maybe they're filled up. Then you add in the component of the pandemic where it's exacerbated and they may not have lots of space to unfortunately house patients that are suffering from mental illness or any sort of substance abuse disorder, needing rehab, different treatments, and so forth. So it's really important to be aware of this list. You could keep it for your records. You can refer to it when necessary. Maybe there's a patient that could benefit from one of these treatments you have, and you could offer them this type of resource and lifeline maybe to them. And you actually could build upon it. So when you offer it to your patients, you could also, maybe you have a connection where you had a friend from school, like I had mentioned beforehand. Maybe they are practicing in the area, or a friend of a friend. It's able to widen the connections. Because as you can see, there's so far and few between behavioral health resources. These resources are what people need. And if they're not able to find them, whether it's due to limited access of Wi-Fi or do not have a computer or another resource, you as a provider could actually provide them, no pun intended there, but you could give them these resources and help them navigate through this tricky path of mental health and behavioral health. So as I said, you can provide a list, but again, the important piece with that list is to be cognizant of social determinant of health needs. Now, I'm sure you all understand what these needs are, so I don't have to spend time explaining that to you. But take into account, this is a rural community. Maybe they don't have access to transportation. Maybe some of those resources that are within that list are closer to Kennebec than to some people that live within Somerset. Maybe they're not able to reach that clinic. So how can you help? Maybe you could just have that conversation with them. You can maybe try to find them a ride or use the platform Aunt Bertha, which is widely used throughout Maine, and that provides social determinants of health needs at reduced or free cost to some people as well in Maine. That could be a resource, using additional out-of-box thinking, essentially. So that all would really help your patients in navigating the path to help. So just to recap, what's our role? Our role, as I'm saying, as if I am one of you, but I think it's important to use the word our, because it's for the community we work together. You can educate patients in the community on importance of behavioral mental health. Share with them that cool graphic that I showed you, what mental health is and isn't, why it's so important and crucial for us to take into account if we are feeling a specific way, to have a conversation, because it's okay to not feel okay. You can pay attention to the signs and symptoms of mental illness. You can be a better advocate for your patients, because again, some of them do feel that stigma and are nervous to come forward when they aren't feeling okay. You can provide those necessary resources from that list that I shared with you all. Feel free to share that with your community, but also with people within your clinic or other clinics that you know of. Speak openly, network. And again, always make sure your patients feel comfortable and that they are not alone. It's so important as providers, you guys are able to listen to them, from close relationships with this tight-knit community, and you're able to help them. They feel comfortable with you all. So that's just the big piece on how you guys are able to bridge the gap in behavioral health services. That's your role. You're able to increase the behavioral health specialists that aren't available in Maine right now. While there is a grant to help fund students becoming behavioral health specialists, we all know, sadly, it's going to take years to provide that to the entire Maine community, let alone rural communities. So you, as primary care providers, can temporarily bridge that gap. You can help observe signs and symptoms. You can advocate for the importance of behavioral health, and you can provide a list of these resources and help connect patients to them. So, see how easy it is? It's not too bad, right? I totally think that it's doable, and I appreciate you all taking the time to sit here and listen to me today and conclude our session 1. So knowing all this information, it's now your turn to help form this bridge for our community. Thank you all.